devastated and Sri administrative area. We came here to Juba to attend this South Sudan Health Summit to 2025.
Let's add the
I
volume.
believe for me it was a very good chance for us to present the situation, the health situation in Abyei. I believe we present our presentation in that summit and we reflect on what we are facing in Abyei, the health crisis. As you know, for this summit, I believe it is a good chance because it was for us to reflect what we are facing in Abyei. If I told you there is influx of
So let's check the audio.
Sudanese to Abyei, especially in the northern part of Abyei.
Is that what he said?
There is a lot of refugees, a lot of
refugees?
refugees, and you know, during this ongoing war in Sudan, more than 3 years, even if we took children of refugees, there is no vaccination. Which is mean now, these days, there is outbreak of measles, especially among these refugees and returnees children. I think before some months back, also we have cholera, which came also from the northern part of Abyei, and we succeed to control it. But now we have another outbreak of measles. And the good thing now, our National Ministry of Health, they are aware about this thing, and I think now they are moving well to release vaccine to the area, and I believe a general campaign will be done. And the second thing also, there is outbreak of hepatitis E. Hepatitis E now is killing our people also in Abyei. And we update our National Ministry of Health and all the local partner. They are aware also. As you know, this hepatitis E, the way that you can get it is waterborne disease. Is the waterborne disease because there is a lack of wash in Abyei. There is no partners who are working on this. There is an issue of drug supply, which is not enough for our people. Even the number of populations, according before some years back, the National Ministry of Health, all the partners, they are still thinking that is the same population. But our people, South Sudanese, they came back from Sudan due to this war, and they integrated. Some of them, they have been integrated in the community, and some of them, they are in the northern part, and they are sharing with us health services with us. So the consignments, the drug consignment that we are received from the national, either from partners or from the national, is not enough for this high number of population in Abyei. I think this is one. The issue of insecurity in Abyei is another challenge also. Now we are receiving all the gunshot cases due to this ongoing war in Sudan, especially in the Bapanosa some days back. But after Rapid Support Forces captured this Bapanosa, and I think we received cases, and now the situation become cooled down. For other areas around Abyei, now all the health facilities are not functioning due to the insecurity some months back. But I believe these days, the security situation is better than before. As you know, also UNISFA is there, but although the president of UNISFA, we are still also facing this, the movement is very strict to move for supervision support or to visit health facility. I think this is some of the situation that I can affect. Maybe I will come back in case there is more question. Thank you very much.
Thank you so much, Honorable, for that enlightening, eye-opening view into the situation on the ground in Abyei. So next we turn to Sigi. So 2025 has been a turbulent year for South Sudan. Conflict is escalating, crises are overlapping, and access to healthcare continues to shrink. What does MSF's new report focus on, and why release it now?
Thank you, Heather, for the question. Welcome to everyone here in the room. It's really for us a pleasure that so many people are joining this very important event for the release of our report. Perhaps just to wrap up at the beginning, MSF in South Sudan is present since 1983, so marks more than 40 years. 2023, we actually celebrated under GIME 40 years of MSF in South Sudan. It's one of the biggest MSF intervention worldwide, which also shows the commitment of MSF to the South Sudan population. We are running at the moment 14 projects, mainly secondary healthcare projects, which means a big support of health, secondary healthcare projects, hospitals. And just to give you a number, in 2024, MSF total budget in South Sudan was $119 million yearly budget. So it shows how important and how big the needs are in South Sudan. So to the question why we released right now the report. I'm here since 4 years, and what I saw in 2025 is even for South Sudanese situation a worrisome one. We see an escalation of violence in the country, attacks on healthcare facilities, outbreak of epidemics, natural disasters like floodings all over, and the shrinking response on donor support to South Sudan, but also the call out for the government of South Sudan is not very effective to support their own healthcare system. So to be more precise, which are the main findings of the report, just also to put it here, and then afterwards it can be found in the report as such, is, as I said, the humanitarian situation in South Sudan is deteriorating. As the Honorable mentioned already, we are facing several crises at once. We had the biggest cholera outbreak in South Sudan this year, which was very, very heavy one. Over 80,000 people were treated under sometimes very horrible conditions. We have now hepatitis E all over the country spread. Why? Because there is no investment in wash infrastructure. The sanitary situation in the country is really deplorable. And this all shows that the health system is stretched to a breaking point. We have not enough fundings, we have not enough commitment to the healthcare facility, to the health system in South Sudan. And even though mentioned before, MSF is one of the biggest players, we cannot and we are not able, and it's also not our role, to solve the situation in South Sudan's healthcare system. As you might be aware, and it was also addressed in the last health summit, the government of South Sudan is putting 1.3% of its annual budget to healthcare, which is way far beyond everything that we can even imagine. And we have to be all very transparent and clear, the 1.3% not even reaching the population. So here we are seeing a huge need to step up on one side from the donor community to, to follow the commitments that they gave to South Sudan, but also the importance of the government of South Sudan to step in. Okay, I see the sign. One minute. No. Another point, which I mentioned already before, is the escalation of conflict situation in South Sudan, which means we're seeing attacks on healthcare facilities all over. MSF had noted attacks of our health facilities 8 times this year. Now we're even reaching 9 times, as you might have heard about the situation in Piri last week. Means there are a lot of people. We had to close 2 hospitals this year, the one in Ulang and the one in Olfangak, which means 400,000 people are left behind without access to healthcare. And another problematic that we see is the agility of the health system, because when people have to flee due to conflict, means as well they have no possibility anymore for standard health facilities where they can reach, because there is no supply in the areas, there are no healthcare workers able to work in those areas. So also for us a call-up for emergency response, and also the call-up to the authorities to grant us and other healthcare workers, but also the MOH, a safe passage to the population in need. So yeah, I will stop here. There would be a lot of other examples to mention, but perhaps later on in the discussion we have the opportunity. Thank you, Heather.
Thank you so much, Siki. Indeed, none of this can become the new normal here in South Sudan. So next, Dr. Humphrey, thank you so much for joining us today. The Health Sector Transformation Project, the main donor-backed mechanism for delivering primary health care in South Sudan, is now 18 months into its rollout. From WHO's perspective, what have been the main challenges in transitioning from the previous system? And beyond the funding constraints, what are the main barriers to delivering medicines and supplies today?
Okay, thank you very much, and really thanks so much for inviting us to this very interesting discussion. I think most people were there last week during the health summit when a lot of the challenges that the sector is facing were openly discussed. I think this, for me, was quite good. It's not about hiding issues. It's the government colleagues, partners who are coming out and saying, these are our challenges. How do we come together to address quite well from what was happening last week. The HSTP replaces a set of projects. I think it's a good effort at bringing partners together and supporting as one. We had the Health World Fund and the World Bank UNICEF projects, which were running previously. When we discuss with a lot of partners, many of them were complaining until today that we seem to be stuck in just a humanitarian response approach in South Sudan for the last 15 years. Some people have gone and come back and they say, well, the country is still the same as it was maybe in 2010, 2011, and so on. So the HSTP was designed to try to break out from this cycle, to move away from a traditional humanitarian response towards one which is more development focused. And that, of course, meant a much stronger government leadership and so on. The aspirations, and I use that aspirations here, not the reality, quite interesting, quite good. I think there was a strong push around equity because previously different people were getting different services across the country. So how do we have one standard? If we have half a pie, how do we make sure everybody gets the same piece out of that half a pie? So there was that strong equity push. There was also a very strong focus on efficiency. How do we, again, make sure that we are reducing transaction costs? Having two different or multiple bureaucracies managing the service delivery in a country like South Sudan is quite costly. We all know cost of doing business is quite high. So how do we centralize, how do we standardize the systems and get some cost savings there? And then, of course, the effectiveness of the interventions. Every person, people in South Sudan get even with the same kind of resources. So how do we have some uniformity around maximizing equity, efficiency, and effectiveness? That is the way I usually summarize what the aspirations of the HSTP were. Of course, things don't play out the way we plan them. The conflicts, I think, as you've highlighted quite well, the security challenges, the huge problem that we've been faced with the conflict in Sudan, because that keeps bringing new challenges, population displacements. Our cholera outbreak was quite unique because it's usually with the cholera outbreak, you have a particular focus. It will be in Lusaka and then spread out from Lusaka. In the pediatrics ward, and you go to the government side and or the HSTP side, and you really see people struggling. So I think it's still a work in progress for the country. It's really the first time we're giving government leadership across the sector. A lot of lessons are being picked up, but I think in my view, or in our view as WHO, we just have to keep plowing ahead with this approach. We cannot turn back and go back to the routine. Thank you.
Thank you very much, Dr. Humphrey. Terry-Ann, access constraints shift constantly in South Sudan, with escalating conflict making them all the more acute. From your vantage point as head of access for WFP, what challenges have you seen emerge in 2025 compared to previous years?
So access has never been easy in South Sudan. It's a very complicated environment. It has a lot of challenges with regard to infrastructure, roads, communications. All of these make it a huge challenge in any year for humanitarians to be able to reach those most in need. These are further impacted by the climate, that we can move mostly during the dry season, and we have to do pre-positioning, and we have these little windows of opportunity to be able to get and reach people in need for as little money as possible in order to maximize what we can do and who we can reach. We have to navigate subnational conflict systems that are the everyday of South Sudan. These are things that exist every year, the conflict systems in various areas that spring up and intensify during our time of year that we can move the most. And that's something that humanitarians have dealt with for years and years. It's a lot to navigate. And then 2025 came along. And we started to see an overlay of additional conflict that broke out that made it even more challenging. We didn't have a bit of a down season this year when it came to fighting. We've seen conflict straight throughout 2025. There's been an increase in kinetic activity across the board. This is ground offensives, this is airstrikes, etc. These are new things that many humanitarians haven't had to deal with, at least in years, and sometimes ever in South Sudan, depending on how long they've been here. Our national teams, of course, have had to do this, but not for some time, and they remember how difficult it was then, and it's still not easy to navigate. We've started to find ourselves having to navigate new areas of control and influence. So even if you're whether you're a static facility, like a health facility, or like WFP, you're moving things through the country, you're having to navigate who controls what area and the conflict that might spring up in crossing those different front lines as you pass through. That's a huge challenge and an evolving one, because these areas of control don't stay the same. They've moved, and that's something that we have to constantly stay on top of, commit resources to, et cetera, in order to understand what's going on, in order to keep our team safe, keep beneficiaries safe, keep the commodities protected as well, because in the current resource-constrained environment, when things disappear, when assets are destroyed, when commodities disappear, when things are looted, they're not coming back. We don't have the resources at this point in time to be able to replace things once they're gone. So it's more and more important all the time for not only humanitarians to be navigating this, but for government, opposition, et cetera, to help us navigate that, to create humanitarian space and to create a conducive environment so that we can reach people in need. I'll leave it there.
Thank you very much, Terry-Ann. Indeed, it's I hear quite a difference in the last two interventions, in the sense that it sounds like health systems are being designed with a development focus for stable conditions, and yet it's difficult for humanitarians to keep pace with the way the violence is actually moving, and how to shift quickly when fighting spreads and people are forced to flee. Thank you for highlighting that for us today. Sylvia, thank you so much for joining us. There appears to be a disconnect between rising needs and shrinking donor resources in South Sudan, both this year and going into next year. What funding trends have you seen emerge, and what priority areas do you feel have lost focus?
Thank you. Is it working? Yes. So yes, as you said, unfortunately, there is a decrease in funding, and I think this is very clearly seen by everyone. So when we talk about trends, there is a sharp decline in external funding. We have seen from last year clearly some donors going from almost 700 million to 280, which is increase. It's a huge decrease, but also we are hearing from other donors that might also happen, so the consequences still might be worse in 2026. I think there is clear commitment from the international community and donors to keep supporting South Sudan, but this is a systemic change. I mean, there's no way the gap is going to cover, so the question is going to be more on how we collectively agreed on the critical priorities forward, and we make sure that we align towards those priorities. So some of the trends that we have seen, obviously there are there is still a very low investment from the government in terms of financing health. I think it's around the 2% of the budget, national budget, that goes to health. But more dramatically, also only 25% is executed. So obviously there is also on one side this sharp decline on the funding from donors, but also we don't see yet government stepping in and increasing funding, which would be required. And this has consequences. So when we look at the humanitarian needs response plans this year and how much is it funded, it's I think it's around 42% as for the financial tracking system and OCHA data, which compared to previous years that was around 70% is a huge decrease. When you look at where the money goes compared to previous years and in terms of trends, I think that food insecurity remains very high, health and nutrition, but when you look at how well the plans are covered, you see an important decrease in 2025 when it comes to health and nutrition. No? So those are a bit of the trends. Health sector transformation program, Dr. Karamagi was commenting the importance of the program, but a lot of challenges in the implementation, which is also affecting the delivery of services clearly. No? So in front of this situation and what we have done collectively with the humanitarian donors group is try to look at how the humanitarian system is going to prioritize. And unfortunately, as we said, because this is here to stay, how do we make the best of existing funding? How do we prioritize? And there has been some conversations and efforts with OCHA and with the humanitarian and the HCT on this prioritization, whether that's... Sorry, is it working well now? Yeah, it's better? Okay, thank you. So no, we're saying in terms of efforts to prioritize, whether that is in terms of priority areas, whether that is in terms of life-saving activities. If not all funding can be, if we don't have all the funding needed, what are the key activities per sector that are really the ones that had to be prioritized? So there are efforts on that direction, and I think in that sense, as we said, common shared vision of where are the priorities in the health sector is critical, but also common advocacy efforts towards access, we were saying, but also towards funding and allocation, coherent allocation of funding to the most critical needs. In terms of the areas that might be a bit less prioritized, it is difficult to see. As I said, I think we have had a lot of conversations around where to put the priorities, not so much where not to put them, though some signals are still already visible, and we are a bit concerned regarding, for example, protection, where the protection is going to be and sexual gender-based violence and other key assistance towards protection can suffer in terms of less prioritization, WASH, surveillance systems, anything that is more preventive and less life-saving. So I think the key message here would be that unfortunately prioritization is going to happen, which means that compromises and trades-off are going to be made. So how do we collectively follow on the consequences, monitor risk, and make sure that still the humanitarian system remains fit for purpose to respond to emergency, as MS was commenting.
Voilà. Thank you very much, Sylvia. Thank you all for your reflections here today. Before I hand over to the floor for questions, I'm going to ask a few follow-ups if I can. Siggy, what are the main recommendations of MSF's new report, and what operational challenges do you foresee for 2026?
Thank you very much. Yeah, one of the first recommendations out of our report is that we need renewal of international prioritization of South Sudan. I guess everybody who is out there knows that South Sudan in the international media is almost never existing. I'm from Europe, people asking me often, South Sudan, what is that? No, honestly, it's like this. Huh? So it's really shocking sometimes. So for certain, we need a renewal of international prioritization. This is also one of the main aims of this report. to bring South Sudan back on the stage before the curtain. Another one is definitely also to see the existing health system transformation project, the HSTP, but also other health system supportings in South Sudan to be strengthened, to be fixed. I know Dr. Humphrey already mentioned it, and also in our discussions with UNICEF and the World Bank, there are discussions how to strengthen it. The main challenge is still linked to the first point. There is not enough fundings. We know we are facing challenges all over. There was, in the Health Summit, for example, the Boma Health Initiative was one of the main success stories mentioned there. But the people in the reality who are out there know that the Boma Health Initiative is a complexity of access to people in need. Healthcare facilities are under attack. As said before, 2 of our health facilities has to be closed. It means people have no access. It means also this agility in terms of how we are working in this healthcare system in crisis has to be rethought, and also we have to have the commitment of the players on the ground and the military and armed actors on the ground. Is it the SSPDF, SPLA-IO, or other non-armed groups, non-state armed groups to guarantee access and safety to our teams and the healthcare workers on the ground. Which brings also to our last point, definitely one is has to stop the attacks of healthcare facilities and healthcare workers in the country. As mentioned before, we saw it in 2025, a huge deterioration only to MSF facilities where we were heavily affected, and this has to stop. In the internet.
Through MSF, because we are sharing Manabeg Referral Hospital with MSF, so we collect 5 samples and it has been sent to the national level for testing, and 5 samples were positive. So after that, we're supposed to declare the outbreak of this measles outbreak. And we engaged with our director of preventive medicines, I think Madame Yar, I think she is aware now, and I think there is a plan maybe on this week or next week. I think the vaccine will be sent to ABA for the general campaign for measles. This is what we are doing now. Before I came here to Juba, I think we sent our team from EPI department. We have a vaccine in the cold chain in that time before I came here. So we conduct a partial vaccination because there is a place in the meat market. Most of the cases of the measles came from that side, especially among the refugees and returnees. That's why we vaccinated more than 616 children. And cases are still coming. So this is what we are doing now to stop this ongoing outbreak of measles. For hepatitis E, I think is related to WASH. As I mentioned before, there is no partners who are working in this side of WASH. That's why most of our people in ABA, and I believe in other areas in South Sudan, people are still drinking from river. And even the water source in the town or even in the area, we are not sure if these water are safe for drinking or no. So which means that there is a need for partners to work in WASH and then also to do testing for water to make sure that this water is safe for drinking. I think this is so. I believe the case, I think, have been reported to the National Ministry of Health, and I think even one of the director from the emergency, the director, I think he promised also, maybe also they are going to send us supply, and on awareness is ongoing, especially in the Amiat side, but also we have to do testing either monthly or every 2 months or 3 months to test the water to make sure that for other water source, we have also to maintain those water sources which are not functioning. It need also to be maintained. And I believe these things cannot be done without more fund, to mobilize more fund to solve these issues which related to which caused the outbreak in the area. And I believe it's not just BA, all the state and other administrative, they have the same problem. So the role of our National Ministry of Health or our national government is need also to support this side, not just partners, and I believe they will take lead for these issues. Thank you very much.
Thank you very much, Honorable. Dr. Karamanki, as you rightly pointed out, there's a difference between aspirations and what's done on the ground. So I understand, for example, that essential malaria drugs this year through the HSTP will arrive only after the peak season is actually already finished. So what lessons stand out for you, reflecting on the largest cholera outbreak in South Sudan's history this year, for strengthening healthcare delivery next year? What lessons have we learned and where are we going?
Okay, thanks a lot. I think, as you've rightly mentioned, there are a lot of, the HSTP is struggling with a lot of operational challenges. Getting paperwork cleared, getting drugs in time, they come, we're struggling with clearing goods, and so there's a lot of operational problems which keep coming up and are difficult to predict. I think most people are facing similar challenges. I think one of the key things we've seen is when we work closely between the humanitarian and development partners, we're able to then start to narrow some of those gaps. For example, last year, WHO, working with the SSHF and other partners, were able to, this year, not last year, were able to at least plug parts of the gaps in the malaria commodities using humanitarian resources. So I think that's quite clear. We need to start looking at ourselves as one sector, not as this and the other partners, which ties for me with the three areas which I think that we need to urgently focus on. The multi-sectorality, which is what basically I'm talking about. How do we bring everybody together to solve common problems, as opposed to each of us looking at this as our own challenge? I think that would be quite critical for us. The second area where I think we can make a lot of progress, even with the resources we have, is how we are engaging our communities. There's a lot of community resilience. I think everybody who is here really knows these communities are doing quite a lot, keeping facilities going which have never received funding. Some facilities have never ever got support, but they are still open and working. And those are quite important lessons, important experiences which we need to draw on. So how do we build real community engagement? Not just taking services into the community. The Boma Health Initiative basically is taking services into the community, which is good. It helps us to close access gaps, but you're still not engaging the community. They are passive in this process. So I think we need to look at how we can build a real community engagement. Our health promotion interventions need to be better targeted. And then the third area is, which we've not explored extensively, is the area around integration. It doesn't help me to have a very good cholera response, stop people from dying of cholera, but then they go off and die of measles, or they die off of malaria or something else. So can we start looking and providing services in a cohort-based approach? We say, what are we providing for under 5 children to make sure that people can successfully move through the under 5 age group? And what are the different challenges they are facing? Are we able to bring the services together so that when an under 5 comes to a facility or comes to a community health worker, they are able to have most of their needs addressed and not just a particular disease program? So working together, multi-sectorality for me is very crucial. The building real community engagement, I think would help a lot, and also integration. That is within the resources we have. Looking, if we're able to mobilize additional resources, I think if you think about it, when you go for health services, there are 3 what we call frontline or front-facing investments which are important that the sector needs to have. One is staff. So the clinician or the nurse needs to be there. The second is the commodities or health products, as we call them, the drugs, the supplies, and so on. And the third is the infrastructure. Yeah? So those what we'd call the front-facing. What does a beneficiary engage with? What those are the ones which create the care, create the interventions. HSTP, for instance, is focused on only two. So it's largely focused on staff, incentives, and so on, and on commodities. If we do not look at infrastructure, then the quality of services will just go down over time. So I think we need to start getting that balance right around the front-facing investments if we are to start to impact on the quality of outcomes that the people in South Sudan are able to benefit from. I think I'll stop here for now. Thank you.
Thank you much. Thank you very much. I think we can open up for questions from the audience now. We're also available for questions. Oh, can you hear me? Yes. Available for questions online. If there are any, they will reach me here on the stage if you have any. Please, don't be shy. Questions for our esteemed panelists, please. If we could have some help with the microphone. Voilà, here. There's a microphone coming for you here, sir. Please state your name and your organization and keep questions relatively brief, if you may. Thank you.
Yes, good morning. My name is Bull. I work for OCP. I agree with your presentation. All the presentations were very nice, very good. And of course, you mentioned a lot of challenges, ranging from lack of resources, lack of human resource, lack of infrastructure, lack of funding, and so on and so forth. These are the real things that are actually happening in the country. And of course, I would want to ask the Minister a question. We understand these interventions requires holistic commitment, efforts from all, be it the government, humanitarian partners. But what is that the government?
And that plan is facing the implementations. Because you know, even our staff in different health facility, now they are not getting salary. They are not getting salary. So this is another problem. Okay, while the staff are not getting salary, so there is no data, there is no performance, you're going to face a challenge for performance. Even some of the staff, I think now we have 3 or 4 health facilities supported by this fund of HSTP. During this summit, they reduced some health facility. There is a reduction to remove 2. Now from Nabia, they removed 2 health facilities. These 2 health facilities now are not going to be continued supported, either with incentive or drugs. And the location for these 2 health facilities are very far from other health facilities, which means that our people are going to move from that very far area to the near one, which is not near already. So the government, even from the national level, now even the National Minister of Health are not, I don't know the budget that have been allocated for the health. It's very limited support. It's the same in the state level. There is no, just what we have now in ABA is the operation cost. And you know this operation cost can be used just for fuel, for papers, for other issues, even for the hospital, which is not, you cannot do more with this. Sometimes it cannot reach above to 3,000 SSP, maybe 1.5. That money cannot do anything. Even what we plan in the plan, how can you implement it that plan? So I think it's really challenging. There is no resources. Just you can have vision, what you want to do, and you can have plan. But to implement it needs resources. I think this is what we are facing. And now what just we have, our local partner, we mobilize them to work on behalf. This is what we know. Yeah, otherwise I think. I think you are a South Sudanese, you are aware about the situation. Thank you very much.
Thank you very much, Honorable. Please, go ahead.
Thank you very much. I'm Mary. I work with IOM. And thank you, MSF, for the invitation. We work together with MSF in many locations as humanitarian partners. And I want to agree that one of our biggest challenges